Welcome back to Surgery, a medical program on VTV where we bring a lot of medical information to you, which is going to be of some help to you, either for yourself or for a family member. आज हमारे प्रोग्राम में एमी लेनक्स शामिल हैं। एमी एक ऑडियोलॉजिस्ट हैं और ख़ास तौर पर वो वेस्टिबुलर मेडिसिन यानी डिजीनेस और बैलेंस का क्लिनिक चलाती हैं लिवरपूल में। तो उनके पास इन्वेस्टिगेशन की सारी फैसिलिटीज़ हैं। तो मुझे बहुत मेरी खुशकिस्मती है कि आज वो मेरी दावत पर इस प्रोग्राम में आई हैं। हम बात कर रहे हैं आज ईयर नोज़ एंड थ्रोट प्रॉब्लम के बारे में और ख़ास तौर पर ईयर के बारे में। अगर आपको कोई सवाल हो, आप जानना कुछ चाहते हो तो ज़रूर हमें फ़ोन कीजिए। मैं और एमी दोनों आपके सवालों का जवाब देंगे। हम बात कर रहे थे ईयर के बारे में कि वहाँ हेयरिंग लॉस किस तरह होता है। ईयर के 3 हिस्से हैं, आउटर पार्ट, मिडल पार्ट और इनर पार्ट। हर तीनों जगह में कहीं भी कोई प्रॉब्लम से हियरिंग लॉस हो सकता है, लेकिन उसकी वजूहात अलग अलग होती हैं। और इसी तरह से कानों में जब आवाज़ें आती हैं उसकी भी कोई अक्सर वजह जो होती है वो हियरिंग लॉस होता है, लेकिन 10 से 12% ऐसे भी लोग होते हैं जिनको हियरिंग लॉस नहीं होता और उनकी वजह डिफरेंट होती है। जैसे अगर आपकी गाड़ी का एक्सीडेंट हुआ, आपको विप्लैश इंजरी हो गई तो आपको ये कानों में आवाज़ें आ सकती हैं। इसी तरह हेड इंजरी में भी आवाज़ें आ सकती हैं। कुछ मेडिसिन ऐसी हैं, कुछ मेडिकल कंडीशन ऐसी हैं जिनमें ये आवाज़ें आ सकती हैं। I mean, there is one condition called hyperacusis. Now, if I can define hyperacusis, means it's sensitive hearing, but that's just the literal meaning, whereas the medical condition reflects the fact that some people find difficulty to tolerate some sounds and their hands are usually on their ears when they hear some sounds. My hands are usually like this when I hear my wife's sound, you know, but no, this is a beside the joke. That, for example, you know, some people will say that vacuum cleaner, hand dryer, hair dryer, babies screaming, children shouting, motorbike without silencer, police and ambulance siren, alarm, loud whistle, loud bell, and weapons noise in action movies and many other conditions. People can find these sounds very difficult to tolerate.
That's right.
And there are also some complex sounds like some loud music as well.
Yes.
Where people will find that they can't tolerate some music. They may not say that they can't tolerate music at all, but some particular music
yes.
they can't. Especially concert, they find very difficult to tolerate that sound. What is this condition?
Okay, so I think most of us have a dislike to certain loud sounds. It's inbuilt into us. It's part of our fight-flight system. So if we hear like weapons movies, we are trained to kind of respond to that. It becomes more problematic when it's more of your everyday sounds. So I'm just trying to think of an example. So music's a good one.
Yes.
So most people can tolerate that type of music, but then you'll have certain people who just cannot stand that music, especially at the louder levels. As long as that person's kind of had a full audiological ENT investigation, there have been some studies looking into kind of the anxiety related, because our cochlear nerve kind of connects the vagus nerve, but that's kind of going outside the realms of
yes.
ENT. So in summary, it is a very, very tricky condition. But a lot of people have dislike to certain sounds.
Yes.
So don't feel like you're on your own if this is you or your family member. And it's just very important to get seen by ENT if
yes.
you are experiencing that.
But I mean, am I right to say that hyperacusis or discomfort to the sound is different from photophonia?
Yes.
Now, in photophonia, we may have the dislikeness. We don't like a sound, but it is not going to cause us discomfort in our
That's
ear.
right. Yeah.
So, a sound may be like, let's say, motorcycle. We may dislike this sound, but it is not necessarily causing discomfort.
Yeah.
Whereas in hyperacusis, there is discomfort mainly.
Yes.
If there is only dislikeness, then it is not hyperacusis,
That's
it is
right.
photophonia.
That's right.
But in hyperacusis, it is discomfort, and some people can't tolerate some sounds. For example, jackhammers drilling on the road, they can't tolerate the sound, and they wear the earplugs.
That's
And
right.
there are
Yes.
other sounds as well.
That's true.
Right.
Yes.
So, is the earplug the right remedy for this problem, or there is a deeper issue?
There is lots of trains of thought in this. There are some people who suggest that the way the middle ear reacts to those sounds is what causes us the pain or the discomfort.
Yes.
So there have been studies into kind of filtered sound therapies to help kind of recalibrate how your middle ear muscles work, and that's some of the Stephen Porges' work that's out there. The way I've been trained is to kind of encourage people to not put the plugs in, and to not avoid those situations. But there are other people who do feel that if a patient cannot bear certain sounds, and it stops them from going out and living their everyday life, then let them wear the plugs.
Would you recommend hyperacusis desensitization, which means that you record the sound and you play from a level which is not hurting your ear to a level which is just about to hurt, and then keep repeating this until your ear gets habituated?
I think you could do that, but you'd have to be careful how often you repeat it. So just if you were going to do that, you would just do it in small doses, just a little bit every day, and build up.
And build it up.
Yeah.
But there are specialists who can offer hyperacusis desensitization, and similarly when it comes to the tinnitus, the sound which you can hear in your ear without any external source of sound, this tinnitus can also be treated. And for the treatment of the tinnitus, we look at the literature search and we find that CBT, or cognitive behavioral therapy, has got an edge over the sound therapy. Now what happens is, in tinnitus therapy there are two ways to treat tinnitus. One is either you mask the tinnitus so the person doesn't hear, which we are going to discuss with Amy, or you control the reaction towards tinnitus, because people are very annoyed, and in this annoyance they get upset, and this upset doesn't help because it makes the condition worse. Any anxiety which is resultant of the tinnitus will make the tinnitus worse. It's a vicious cycle. So we don't want the person to react too much, we want this reaction to be lowered. This is why we bring cognitive behavioral therapy by a psychologist, which helps the reaction towards tinnitus. And then comes Amy. Amy, then you have a role of sound therapy.
Yes. So there have been so there's two forms of sound therapy. So the first one is, the idea is if we restore your hearing, so you aren't hearing these sounds anymore. So if we restore that to you through a hearing aid, then you'll get those external sounds back in, which masks your internal sounds that you're hearing. So that's one train of thought.
But the hearing aid will be only for those who have got hearing loss.
For hearing loss, that's correct.
But in case if the person does not have hearing loss and their hearing is normal,
yes,
then what would you prescribe?
So then we have, they are basically white noise generators that we just, so that we try and match them to be very, very similar to your sound that you hear. And we just mask slightly louder than where you hear your internal sound. So you will be wearing something, and you'd be wearing it for most of the day to begin with, and then some patients find that when they take it out, that helps reduce what they hear without the treatment.
Yes. So is it right to say that when they wear this instrument, which is like a hearing aid,
yep,
in their ear, which emits some noise, like white noise, and you try to match this noise to the frequency of the tinnitus.
That's right.
But the mind will accept this external source which is emitting lot better than no source
That's right.
at all. For example, if you hear the footsteps on the at night on the outside your room, you are worried. But if you know that your husband or wife or brother or sister is in the house and they may be walking on the footsteps or they may be on the stairs, then you are relieved, then you are not worried. This is why an external source is not accepted straight away, but it takes time. But once it is accepted, then it masks the tinnitus.
That's right, yes.
Is there any other way to mask the tinnitus, for example, music?
Music's a brilliant one. So music, people like having their radios on in the background. You can now get little pillows. So one of the biggest problems with people who have tinnitus is it's most bothersome of the night.
Yes.
Because when they're out and about in the day, they're doing their jobs.
So there's a background noise, which is masking.
Yes, but also because they're engaged in activities, they're not focusing.
Mind is diverted.
But when they go home, get into bed, and relax, then they can hear it. So the pillow speakers are actually very good.
Yes.
And they can play nice relaxing music for you to go to sleep to.
That's right. And you can also download or you can go on YouTube to listen to some natural sounds like rainwater sounds, ocean sounds, which are very smoothing.
Yes.
And nowadays there is an app called Breathe.
Yes.
This Breathe app can relax you a lot better at night, especially when you're trying to sleep.
That's right, yes.
Yes, sleep is a big issue with tinnitus patients, especially those who are suffering with very annoying tinnitus.
That's right.
Yes.
And I do think that your sleep routine is very, very important. So if you can spend a little bit of time, and I know if you've got children, and I have a 5-year-old at home, so I know how difficult this can be, but if you can just spend an hour relaxing before you try and go to bed, rather than rush bed, you probably will, your tinnitus will be less as loud. Yeah.
When you say relax, do you mean to say have a shower or a bath?
Yeah,
Yes.
or read or
watch TV?
Yeah, just do something that you time before you go to sleep.
Absolutely, yes, I agree with you. Now, then we come to the hearing loss, which is particularly the inner ear hearing loss, where you mentioned that the treatment is surgery is not possible, but the hearing aid is an option. So what is the job of the hearing aid in hearing loss, which is sensory neural or the inner ear loss?
So hearing aids have come on a long way, and what they do is we can now tune specifically the frequencies that you have lost. So often the type of hearing loss we're talking about, you have normal low frequency, so you could hear thunder or you could hear cars as you would have in your 20s, but as you get older, often you lose the high pitched sounds. So they're like the really they're often the sounds that give us the understanding of speech, those sounds. And with hearing aids, instead of us turning the volume up across everything, we take your hearing loss, we also look at the resonance in your ear canal, and we take some little measurements and we just turn up the parts that you need for you to hear speech.
Right. So you match the loss, how much loss it is, you match the gain. This person needs, these frequencies are affected, so these frequencies needs to be matched and amplified.
That's right.
There are hearing aids which can address both hearing loss as well as tinnitus. For example, Signia notch therapy.
Yeah.
So they are very good in the market, aren't they?
Yeah.
Yes. Do you recommend those hearing aids which have got the notch therapy?
I think I wouldn't recommend them broadly, no. I think they are very suitable for certain types of patients and not all types of tinnitus patients, yes.
They are tailored according to the individual needs.
Yes,
I agree with you.
Yeah.
So, ladies and gentlemen, we are discussing about the ear problems. We will be talking about the balance issues in a minute. But if you have any question, please feel free to ring us. We are taking your calls as well. We have answered one call which was about tinnitus. Now, the dizziness, as we have explained what dizziness is, let's go into the medical causation of dizziness. There are 5 parts which are very important in the causation of dizziness. One is, you mentioned, inner ear. Then there are certain information which brain is dependent upon, that how our position on this in this space is. So eyes can give the information to the brain about our position in the space. Then our neck, which gives the stimulus, or which gives the information from the neck to the brain, that how our neck is in the space,
in the field of space.
yes, as compared to our body. And similarly the feet will also give the same information. And then some information will come from the 2 different parts of the brain known as cerebrum and cerebellum. There is also some contribution from the heart, and which we will discuss. Now let's talk about heart first, so that it's out on one side. Some people will say that when I stand up, I feel little lightheaded, and these are the people usually who are taking medication for high blood pressure.
That's right.
And these patients, they suffer this problem because their blood pressure suddenly drops when they stand. So this is known as postural hypotension. Then we come to the main category now, which is vision. Some people will suffer with visual vertigo, because the one eye is giving a mismatch information to the brain as compared to the other eye.
That's right.
And the brain will get confused that this eye is telling me something different than the other eye. So the person must be in danger, and this confusion state is known as dizziness, so that you can sit down and protect yourself. Now it is very important that if you are suffering with dizziness, you must go to the optician, to your local optician, and have your eyes checked before you see the consultant, because the consultant is going to ask you, have you had your eyes checked, and you will say no, and you will say go back and have your eyes checked. So it's much better, if you are suffering with dizziness, have your eyes checked by your local optician. Make sure that if there is a need for glasses, then you should wear the glasses. Otherwise your visual vertigo may be contributing, and it will be a little waste of journey to the consultant in the hospital. Second is neck problems. Some people do suffer with arthritis of the neck.
That's right.
Now, and they can't move their neck properly, and once they move their neck, they feel little lightheaded or dizzy, or whatever they describe. So those people should consult their physiotherapist.
That's correct. Yes.
Yes, and they should do some self-help in forms of therapy at home by moving their neck. It's very easy. You just have to move your neck, no, and yes. Now this is the simplest exercise, but I'm going to ask Amy if Amy can tell us about other exercises which are helpful for the neck.
So for the neck, you have to make sure that you don't push yourself. So don't, if you feel any pain, don't go there. But the more you can move your head, the better. So you want to get your head so it's on an angle from the center, and you want to be doing this as well. So you're kind of at 45 degrees from center. That's a good one to do. And the same this. If you've got young family at home, you could even try sitting down and get one of your youngsters to throw a ball to you so you can catch. That's quite a good one as well.
Yes, and then comes to the inner ear. So there are causes where you will get an episode after a cold or a cough of intense dizziness, in which you will be dizzy for a couple of days, which is known as labyrinthitis. It can be viral, it can be bacterial. Now the bacterials are usually uncommon, virals are very common. It will disappear, but you will have dizziness for a month, 2 or 3, and this will then subside. Then there are some medicines which can cause dizziness, especially if you are taking some medicines for mental health issues, they can cause dizziness. So you have to make sure that when you consult your GP can look at the side effects of these medicines. They can cause dizziness. And then there are other conditions which can be associated with the hearing issues, but I don't think you would like to know that kind of medicine in depth. But in summary, the dizziness can be due to inner ear problem, it can be due to your eyes, it can be due to your neck and feet, it can be due to your brain. So there are brain issues as well, where your consultant will examine you. And mostly when I see patients in my clinic, I do a tertiary care dizziness and balance clinic at Salford Royal Foundation Trust, where GPs are not allowed to refer. It's only the consultants of North West England are allowed to refer to my clinic, because it's a very specialized dizziness and balance clinic. I find that anxiety and stress is also playing a very significant role. And some people, I wouldn't find any cause at all despite of my best investigations, but they are dizzy, and finding and in going in depth into the history suggests that there is underlying significant stress which people have not realized sometime. So it is very important that a very holistic approach should be adopted.
That's right.
A very good history should be taken, not a 5 minutes history.
No, big history.
Right. An investigation should be done, and then the patient should be reassured or provided a diagnosis, and therapy should be arranged.
That's right, yes.
We are coming to our end. Thank you, Amy. So nice of you to come.
Thank you for having me.
Thank you to the viewers who have been listening. We will be back very soon. And thank you to VTV for arranging this program to raise the awareness of medical health issues. Thank you.